Have you ever been to the hospital? You got admitted as a patient relative or you haven't? Well, sit back and watch till the end of the video because I will mentally take you to a tour in the hospital and educate you on who to meet. As a first timer, you must have the fear of the hospital or white coat. Trust me, all the medical personnel are your friends. You just have to trust them and you will recover quickly. But before we dive further, I would like to tell you that the most important person in the hospital is the patient. Amazing, right? Because all the staffs in the hospital are working for the patient. That's you, if you are the patient. So in the hospital, we have the health staff, which include the doctors, the nurses, radiographers, medical laboratory scientists, physiotherapists, and pharmacists. If I'm to ask a layman who a doctor is, he will define a doctor as someone that works in the hospital and wears a lab coat, which is capital No. I will define a doctor as someone who is experienced and certified to practice medicine to help maintain or restore physical and mental health. There are different areas that doctors do specialize in segments of medicine, which include anesthesiology, ophthalmology, psychiatry, radiology, nephrology, etc., etc., which they need to work as team to restore your physical or mental health. The second on the team are the nurses. They are the ones that give you the holistic care in the hospital. They work hand in hand with doctors and other healthcare workers to make the patient well. On the other hand, I will call them the mothers in the hospital or the mothers of the hospital, whichever way. Okay, the third on my list are the radiographers, also known as radiologic technologists, diagnostic radiographers, and medical radiation technologists. They are healthcare professionals who specialize in imaging of human anatomy for the diagnosis and treatment of pathology. To make it short, they are the photographers of the hospital. That's the eye of modern medicine. Fourth on the team are the medical laboratory scientists. They are also the crucial part of the team by performing diagnostic testing of blood and body fluid in clinical laboratories. So if you're going to go for your blood tests, genotype test, anything with blood, you will meet your medical lab scientist. And then we have the physiotherapist or the physical therapist. They work with patients to help them manage pain balance, mobility, and motor function. At first, when we hear someone is a physiotherapist or we hear a physiotherapist, you will think that that person is a massager or he only do massage, but physiotherapy come with a lot of package. So you can also have your own personal physiotherapist, or if you have any issues or you have any injury after a car accident or something, your doctor will assign you to be visiting a physiotherapist. And the last on my list here are the pharmacists. That's the Pablo Escobar of the hospital, but this one is plainly legal, also known as the chemist or the druggist. They are responsible for the management and distribution of medicine and has the specific knowledge to counsel patients. And on the other hand, we have the administrative and clerical staffs. Those that coordinate and facilitate patient care. They schedule appointments, answer phone calls, greet patients, keep medical records, handle medical bills, blah blah blah. They handle all, and they also handle the financial records. I hope you enjoyed this video. If you did, a thumbs up will be really appreciative. Here's a reminder to subscribe to my channel and click on the notification bell for more videos. Thank you for watching and stay tuned for more from Susu. Bye.